Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. And we're continuing in our journey of understanding some, not all, of course, supplements that have an impact on dentistry. Boy, I wish I had enough time to review all of the supplements that our patients use. I could really spend hours of your time talking about all of the different types of supplements that people use for all different types of conditions. But I want to really focus on those that seem to have an impact on dentistry most of all. And of course, the first one I like to talk about is Black Cohosh. And you might say, well, Black Cohosh, why have I not heard of that before? Well, Black Cohosh has been touted for the treatment of symptoms associated with both menopause and PMS. But that would mean that it has some type of estrogenic potential? Well, that's exactly right. Black cohosh contains phytoestrogens and alkaloids with serotonin activity. So therefore, again, black cohosh may be likely to be successful in treating things like menopausal symptoms, hot flashes, night sweats, that sort of thing, and symptoms of PMS, which we do know that has been effectively treated with drugs like selective serotonin reuptake inhibitors. Well, what's the lay of the land, Viola? Does it work? Well, the FDA has said that black cohosh is one of those dietary supplements we need to be concerned about because, for the most part, patients use it as a form of estrogen when maybe sometimes they can't use estrogen. For example, if they have an estrogen-dependent tumor, the doc may tell them, well, you can't use estrogen. Okay, but they have these side effects of menopause and would like to use estrogen to make them go away. Well, why not a plant-based estrogen, right? If it's natural, it's got to be safe for you, and that's what a lot of people believe. But unfortunately, a plant-based estrogen, a phytoestrogen, can still make an estrogen-dependent tumor grow. So we've got to be very careful in how we use these supplements because, again, a lot of them have ingredients that actually do work, but maybe if they're not used in the right way, can be harmful. Black cohosh does cause GI upset. And as far as the dental considerations of black cohosh, we do know that it causes additive bleeding. We're not really sure of the mechanism, but we think anyway, that it may contain, in some cases, salicylic acid, which is naturally occurring in the soil where sometimes black cohosh is grown. When that black cohosh is harvested, salicylic acid comes along for a ride. And if it's converted to acetylsalicylic acid, well, then you know that's our friend aspirin. And so that can increase the risk of bleeding, especially additive bleeding, when it's taken along with other medications that can cause bleeding, like Plavix and aspirin, antiplatelet agents, and Coumadin, Xarelto, and Eliquis, which are anticoagulants. In addition, black cohosh is known for causing orthostatic hypotension, which means some women who take it really don't feel very well afterwards. They feel kind of dizzy and faint, and we really have to be careful if they're going to be driving a car or operating machinery after that. So that's just one of the several supplements we'll be talking about in this series, my friends. Until next time, this is Tom Viola saying, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.